Okay, now for this next question, I'm going to tell you when I first got this, it was in the form of a statement. I'm going to answer it because I'm going to answer it, and you'll see what I'm talking about in just a moment, but I'm going to rephrase it in the form of a question. Is it illegal for a company to reject me for coverage? Now, when that question was first given to me as a statement, instead of "is it illegal," she just said it is illegal for a company to reject me for coverage. So I'm going to break that one down. First of all, today, as I'm recording this in March of 2018, the Affordable Care Act is still around. And so I'm going to say just a little bit about the Affordable Care Act, even though that's not my primary business. With the Affordable Care Act, Affordable Care Act insurance plan, an insurance company cannot reject a person for coverage based on health reasons, although there are some reasons a person can be rejected for coverage. And the person that gave me that statement actually was confusing Affordable Care Act with Medicare. And the other thing that I want to mention, the other caveat I'll mention before I get too deep into this, is that I am referring to the states that I work in, which is Ohio, West Virginia, Kentucky, and Michigan. There are some, acceptance for coverage for certain types of insurance does change state by state. So it is important, if you're not in Ohio, West Virginia, Kentucky, or Michigan, to inquire with a knowledgeable insurance representative in the state that you're in to find out what your guaranteed options are. So now, with all that said, the Affordable Care Act plans are not Medicare plans. Medicare plans do not necessarily follow the same rules that Affordable Care Act plans do, and that includes accepting a person for coverage if we are talking about a Medicare supplement based on health. Now, there are some plans where they cannot reject you, and I'm going to get into that too. But first of all, take Affordable Care Act and put it aside for the purposes of this discussion. And what I mean by Affordable Care Act, I'm talking about individually purchased major medical insurance coverage for people under the age of 65. The key word is individually purchased, because if you are talking about group insurance or employer coverage, that is not my business. I don't even know the rules to it. So if they're talking something from an employer, a union, or something like that, talk to somebody who knows that. That isn't me. You shouldn't even be watching these videos. I've said this on my website. There's an entire section of it on my website that if you have employer coverage given to you regardless of age, talk to them. Don't even talk to me. So be aware of that. Now, that being said, let's shift from Affordable Care Act to Medicare. Now, with Medicare, there's different types of coverage. There are, for most people, Medicare supplements that go after Medicare, Medicare Advantage plans that go in place of Medicare, and Medicare prescription drug plans that give you that gives you Medicare Part D coverage. I'm going to take them one by one. Medicare itself, you have an opportunity to get Medicare, no questions asked. That means regardless of health, regardless of anything, at a certain point in your life. For most people, it is when you turn 65. 3 months before you turn 65, the month you turn 65, 3 months after you turn 65. That's for Medicare Part A and for Part B. Now, some people, that can be deferred for some reasons, for various reasons, and you just pick it up later, depending on the deferral. For more information, talk to an insurance representative or your benefits administrator, someone who can get more into detail about your specific situation. However, if you're just a normal person with health insurance that's expiring at age 65, you have an opportunity to get Medicare 3 months before, the month of, and 3 months after. Should you refuse it, and there is no other coverage that's going to be there, then you are what is known as having refused Medicare, and you are going, if you pick it up later, you can pick it up, again, no questions asked, but you can only pick it up during a general enrollment period that Medicare has, which at the moment is January through, gosh, I don't do this very often, January through June, I think. Maybe March. So it's the first part of the year. I think it's March. Yeah, it's March. And then it doesn't actually begin until July, and you're going to have to pay a penalty associated with it. So basically, yes, you can get it no questions asked, but you can't just pick it up when you darn well feel like it if you just refused it at the start. If you don't have anything to replace Medicare when you turn 65, you gotta pick it up during the general enrollment period, and you're going to pay a penalty as a result of it. So you pick that, Medicare can't refuse you during your open enrollment period, but that open enrollment period can only happen at a specific time. Now, that's Medicare. Medicare supplements vary from state to state, and again, I'm only going to give you Ohio, West Virginia, Kentucky, and Michigan because there are some states where this is categorically not the correct answer. So unless you live in Ohio, West Virginia, Kentucky, and Michigan, there's a reasonable chance this is not valid for you. Now, Medicare supplements have an open enrollment period. They have two different types of periods. They have an open enrollment period and a guarantee issue period. I'm going to break those down. We're going to start with open enrollment. Open enrollment happens at one point in your life. I will say that again. Open enrollment happens at one point in your life. And during the open enrollment period, you can get any Medicare supplement you wish with no questions asked. Now, the period that you get open enrollment is in every state except for West Virginia, which I'll give you their variant in just a moment. In the states that I service, remember Ohio, Kentucky, Michigan, and West Virginia with a caveat, your open enrollment period is 6 months before you turn 65 or Medicare Part B becomes effective, whichever is later, and 6 months after, which is actually the national open enrollment period for Medicare supplement. So 6 months before, 6 months after, that is a full year in which you are able to get a Medicare supplement. West Virginia's open enrollment period is 1 month before you turn 65 where you get Medicare Part B, whichever is later, or 6 months after, with a provision that says they will allow you to go up to those full 6 months earlier, but they prefer you do 1 month before. So be aware, it's just kind of a wording thing, but West Virginia says 1 month before with an allowability of you to go as much as 6 months before. But either way, you've got that full 12-month period to get a Medicare supplement, no questions asked. Now, once that period is done, it is done. Open enrollment does not come back. I will repeat that after, I've given you silence. Open enrollment does not come back on a Medicare supplement. That means that you are not forbidden from trying to get a Medicare supplement, but most Medicare supplements are going to ask you health questions, and they will accept or deny you based on your answers to those health questions. So the stuff you see on the news about the Affordable Care Act not denying people for based on health does not apply to a Medicare supplement. They can and do deny you if they don't like your answers to a health question. So keep that in mind if you go through open enrollment. Now, open enrollment is that one time. Now, remember I said it's when you turn 65 or get Medicare Part B, whichever is later. You defer Medicare Part B if you've got other health coverage. So what that means is if you've got employer coverage or some other kind of group coverage that is continuing beyond age 65, say it's going until you retire, which may not be until age 67 or 68, and their coverage is going, you can defer Medicare Part B, defer the start date without penalty and without having to wait, subject to your employer approving it, of course. Always check with them first, your benefits administrator. And if they say, yes, you can defer Medicare Part B, and you do until age 68, then, or 67, whatever it is, when it's time for you to say, okay, I want my Medicare Part B, and you enroll, then that is when you get your one and only open enrollment period that goes 12 months before and 12 months after with 6 months before, 6 months after, your 12-month period with, West Virginia's caveat still being the same thing there. And you are able to get yourself into any Medicare supplement you want then with no questions asked. So that is the open enrollment period, the open enrollment rule for Medicare supplements. Now they also have a guaranteed enrollment rule, a guaranteed issue rule. That says that you have a 63-day window to get some Medicare supplements, no questions asked. At the time of this recording, those plans are plans A, B, C, or F. No questions asked. So you can't get every supplement. You can't get a plan G, no questions asked. You can't get a plan N, no questions asked, although you might be able to if you get health questions asked. If you're able to answer the questions with one of the companies satisfactorily. But you can only get a guarantee issue supplement under certain circumstances. If you had employer coverage, but you also had Medicare Part B already, B as in boy, that means that you used up your open enrollment date, and you can't get a Medicare supplement, no questions asked. Because remember, it happens only once in your lifetime, and if you turn 65 and you had Medicare Part B, and it was when you were 65, but you're now 67 and you had other coverage, you used up your open enrollment period, now you've got guaranteed enrollment. That gives you a limited supplement opportunity, and there's a shorter window for doing it. And there's something like 10 other reasons you can get a guaranteed issue Medicare supplement going forward, but there's only a limited Medicare supplement reasons that you can get, limited reasons you can get a Medicare supplement. Although the most common one is you had Medicare Part A and B go into effect already, and you've had work coverage. But you can't say that a Medicare supplement can take you no questions asked at any time. That would increase your premiums significantly, as people are seeing under Affordable Care Act right now. It increases something called adverse selection, and it means the sickest people are going to take the plan, and the healthy people could basically not get the plan until they become sick. So there are limits in terms of how and when you're able to get health and Medicare supplement. So that's the health insurance rule, or the Medicare supplement rule. Now, Medicare Advantage is a little bit different going back. And remember, the question is it illegal for a company to reject me for coverage? Medicare Advantage, you get a Medicare Advantage plan with one question. Excuse me, that's not right. You can get a Medicare Advantage plan with no questions asked 3 months before your Medicare Part B effective date, the month of, or 3 months after. Notice I didn't say when you turn 65. It's when your Medicare, 3 months before your Medicare Part A and B become effective, the month of, and 3 months after. So it can actually happen if you get Medicare early due to a disability or something like that. Your open enrollment where you can get any Medicare Advantage plan, no questions asked, is right then. Now, Medicare Advantage, however, you can't apply for in the middle of the year unless you have a special enrollment period. In other words, a series of circumstances happen. So you get your open enrollment opportunity. Actually, they don't use the term open enrollment. That's not correct. They use the initial coverage election period, which is 3 months before Medicare Part A and B become effective, the month of, and 3 months after. No questions are asked. Whatever plan you want, if it's available in your county and you meet their criteria to get it, you get it. Medicare Advantage, however, then allows you to get any other plan that's going to be available to you between October 15th and December 7th for a January 1st effective date of the next year, with one question being asked, and that question is, do you have end-stage renal disease? If you meet the other criteria of do you live in the area where it's being serviced, do you have Medicare Part B, for the most part that's it, and you answer no to the end-stage renal disease question, and you do it between October 15th and December 7th, you get that plan for the January 1st effective date of the next year. There's also a few other enrollment dates. I believe they're bringing back the open enrollment Medicare Advantage date beginning 2019, but I haven't gotten the specific rules on it, so I can't really speak for it at the moment, although I believe that's coming. Excuse me. And there's also... but that is the rules for the Medicare Advantage plan. Now, the prescription drug plan is pretty close to the Medicare Advantage plan in that you have that one opportunity 3 months before, the month of, and 3 months after you get Medicare Part A and B to get a Medicare prescription drug plan, and it can happen when you're under 65 as well. And then you have the October 15th to December 7th date to get it as well, to change it every year. And, even if you have a Medicare supplement, that's the case for prescription drug plans. The key with prescription drug plans and Medicare Advantage plans is they will reject you if you just try to get the plan in the middle of the year just because. And what I mean by that is if you don't have a valid effective date, they will reject you. So be aware of that, is that you have to have a Medicare Advantage plan, if you want to get a Medicare Advantage plan or a Medicare prescription drug plan, you have to have a specific reason to get it, and it can't be one of your reasons. You pretty much have to ask me, someone like me, you have to ask the insurance company, you have to give a call to Medicare, CMS, and ask them if you have a valid reason to get it. But if you do have a valid reason, you've got a time frame, you've got specific plans you can get it, go ahead and get it. Talk to me, talk to someone like me, help you find the best plan suitable for you. But just in the middle of the year, if you want to get a plan, you can be rejected if you want to get the plan just because. And if it's a Medicare supplement and you want to change, remember, you're not locked out of changing a Medicare supplement in the middle of the year. You can attempt to make that change. But after your open enrollment period for Medicare supplements are used up, if you want to make that change, you have to answer health questions, and they can accept or deny you based on your answers to those questions. It's like every other kind of life insurance. So my point is, when you're seeing stuff on TV, you're reading things about the Affordable Care Act, just be aware that insurance is complicated. There's a lot of different types of health insurance out there, and they all have to follow specific set rules, and it's important that you know what those rules are, and that a person may actually not be able to get the plan that they want if the circumstances allowing them to get that plan is passed, or if they don't fit into the rules set down for getting that kind of insurance. So the important thing, when in doubt, just ask somebody who knows the rules and see if they can break it down and explain it in a manner that you can understand, just so that you're prepared and can make decisions when it's time to be able to make those decisions.